General of Addiction Psychiatry Society of India, and very pleased to talk about Addiction Psychiatry Society of India, APSI. APSI is a very new, very young society, just a 1 year young organization composed exclusively of psychiatrists who are working in the field of addiction sciences. As of now, we have about 180 odd members, including a very well-known set of executive council, which comprises of 11 office bearers and members. All of them are stalwarts and well-known names in Indian psychiatry in the field of addictions. In the last 1 year, we had held one national CME program and first national conference. Both the events were virtual. In fact, our recent December virtual national conference, it attracted more than 500 plus registrations. 2-day conference and with a very wide degree of engagement and participation was very exciting. So as far as our country, India is concerned, we are a low health resource country. There are large treatment gaps in addiction treatment. Some institutes have recently started a super specialty course, a super specialization of DM addiction psychiatry. This is post MD in psychiatry. There are quite a few other psychiatric societies available for other specialties of psychiatry. This addiction was lacking and this has recently been started. We also have a large civil society, but which is dominated by non-physicians or NGOs largely. So what do we expect from ISAM? One is that we are a very new society, but our members have been active in the field of addiction for a very long time, including in many activities of ISAM. So since we have an enthusiastic bunch of young professionals coming every year in India, from India, in the field of addiction medicine, so we would want opportunities for international exposure in ISAM events as well as otherwise, as well as some opportunities for international or transnational collaboration, which may be in the field of academics as well as in research. And lastly, advocacy support for evidence-based policies and programs. There are certain advocacy platforms for which an international voice of an international body that counts more than a national body. So in that particular aspect, we would like ISAM to have provide its backing to APSI. What we can contribute, we do have our own expertise, which will be available for all other societies as well as for ISAM to utilize. Many of us are actually also working for some other countries, including for international organizations like United Nations Office on Drugs and Crime or WHO as consultants, as advisors and experts. We also provide an opportunity for multi-centric research. Now, India is a large country. We have a lot of diversity here, and there is no dearth of clinical material in terms of number of patients which we have. So a lot of research opportunities are there. If we can find ways to collaborate, that will be very useful mutually. And hence, we also look for, we can contribute in terms of cross-learning opportunities or mentoring opportunities for younger professionals from elsewhere.
Dr. Hao, Wei Hao.
Yes, I'm Dr. Wei Hao. I'm Professor of Psychiatry. I'm President of Chinese Association of the Drug Abuse and Prevention and Treatment. Next slide, please. Our society is only one national academic society. Was founded in 1993, and we have 1,500 members. And we have the sub branch include Association of the Addiction Medicine, Association of Alcohol-Related Disorders, and so on. As a national platform, we provide our colleagues the help of clinical and basic research on addiction, and we conducted a series national training course for professionals and para-professionals. And we also have a lot of international collaboration. And we are working with the government for alcohol and drug policy in terms of the development, implementation, and evaluation. Next slide. And we would like to get help from ISAM for the capacity building. And of course, we like to have international cooperation on drug policy and biological research. And we also hope to get the cooperation on the psychosocial and biological research and activities on drug treatment and prevention. And of course, we would like to share our experience from China on drug control effort with other countries. Now in China, we have 3 years, the number of the drug abuse is decreased, and the number of drug abuse who quits the drug for at least 3 months is increased. So I think we have a good experience on drug control. Of course, we would like to host an annual conference of ISAM after COVID-19 pandemic is over. Thank you very much.
Thank you very much. And now we have Seung-Yup Lee from Korea.
Thank you. First of all, thank ISAM for organizing this meaningful and wonderful meeting. And this is Seung-Yup Lee. I'll be presenting on behalf of the Korean Addiction Psychiatrist. Next slide, please. To tell the background, the Korean Academy of Addiction Psychiatry, KAAP, was established in 1996. Has 200 active members. It holds biannual scientific meetings and publishes on academic journal twice per year. The challenges we face in Korea right now, despite ever-surging gaming problems, there were some major drawbacks in regard to policies. A very strong connection exists between the gaming industry and the politicians. The juvenile protection law that limited midnight to 6 a.m. online gaming access is now gone. And so does the monthly spending limit of 500 to limitless, just the year before. There is a steadily rise in narcotic problems, and mandatory addiction treatment is ordered without financial support. Therefore, proper therapeutic opportunity is not currently provided by the legal system. With the recent pandemic, the proportion of behavior addiction is increasing relative to substance use. I don't know how much of the colleague here agree with me, but I think that with lockdown and social distancing, obesity is on the rise. And I think obesity is definitely an addiction problem. Next slide, please. The KAP would be delightful if the ISAM would be able to provide a unified statement and joint actions against the industrial pressure and provide resources to improve the level of care during the pandemic and easily accessible online workshops like right now. And I think we can share our experience in regards to addictive behaviors related to digital media and maybe conduct joint study in emerging addictive disorders. And if other parties in the region have interest, may expand our academic journal to international level in Asia Pacific region. Thank you.
Thank you very much, Dr. Seung-Yup. And we do acknowledge that food addictions and obesity are part of addictive disorders. So thank you very much.
Now we have Dr. Steven Chow.
The Addiction Medicine Association of Malaysia. Can you go back to it?
Yes.
Was conceived in the year 2001 and formally formed in the year 2006. Okay? And it's affiliated from a private practitioners base. So our members are mainly general practitioners with special interest in addiction medicine specialists, and also the paramedical professionals. As I said earlier, unlike most of you, I'm a dermatologist. That's a long story. Okay. Our primary objective is to develop the science of, can I have the next slide? The science of addiction medicine in Malaysia, which we started in the year 2001. Okay. We are not a for-profit organization, and our original targets are very simple: meet the needs of those asking for help with addiction. So our members, active members, are around 200 per year. registered numbers are 700. Now, what are the situations, and we can have the next slide, in Malaysia as far as the Addiction Medicine Association is concerned? Our primary issues that of late that is of concern is decriminalization. This is something that we've been trying to get on for the past 10 years. Okay, we have moved somewhat, but it's not completely succeeded with passing of a decriminalizing bill in Malaysia. Okay, of course, of late it's been the issue of tobacco harm reduction, the end game for tobacco. We have the challenge of multiple non-integrated laws and regulations. That makes the entire enforcement landscape quite challenging for doctors wishing to practice. And of course, at the population level, there's this question of equality and the equity of access to addiction medicine sort of facilities. We need policy change, okay, and then definitely we need to continue to build capacity for the next decade or so. Okay? And the public perception need to be changed as well. On our side, we do our best to provide professional access to early diagnosis and treatment from our member base, and to develop harm reduction intervention facilities for patients themselves. We zoom down onto school children because we feel that that is the point to start. School children and their parents. Can I have the next slide? Okay. AMAM is a small society. Okay, we have very limited resources. Okay, we are self-funded. So we do look for the support from the form of expertise, technical professionals, curriculum development, and funding for research from ISAM. Possible scholarships for our younger trainees. And I think the public and community educational material that is produced internationally will be of much use to us in Malaysia. What we can offer on our side is our history. We have a very strong network in Asia, having done work in this area for more than 20 years, developing a community-based medical assisted substitution therapy for heroin addicts. That's how we started. Okay? And I think we can continue to support the international effort to minimize harm and prevent addiction-related healthcare costs. Okay? With that, I think I can complete presentation. Thank you.
Thank you very much, Dr. Chow. Now we have Dr. Vista.
Hello from the Philippines, mabuhay. I'd like to thank everybody for inviting us to attend this. Actually, we would like to acknowledge ISAM and especially the work of Dr. Greg Bunt in actually organizing the Philippine Addiction Science Society, which is PAS. So next slide, please. So yeah, so the background, as I said, is the PAS aims to be an umbrella organization for all clinicians, researchers, academics, and organizations involved in addiction treatment programs, training, and research in the Philippines. And we have several organizations who are doing this work in the Philippines, but they are not organized under one umbrella. And it's Dr. Bunt who visited us 3 or 4 years ago and encouraged us to actually move forward with this. So what are the current situation in the organization? Our priorities would involve, of course, to expand the addiction medicine services at the community level to improve accessibility to its service users. Challenges and needs. Society is relatively new and is hindered by limited human and financial resources. In terms of services, the society members have been involved in initiating and implementing facility and community-based services. Recently, it has enhanced focus on expanded community addiction services and improved training for carers, and pushing for more research activity, including instituting the first fellowship program in addiction medicine in the country at the University of the Philippines, Philippine General Hospital, where I teach. And I'm proud to have my 2 fellows attending this conference this evening, this morning, and this afternoon. Next slide, please. So what do we expect ISAM to provide? Well, you have provided us the impetus to actually organize. So again, I extend my deepest gratitude to ISAM and its leadership. And since the organization is relatively new, PAS may benefit from technical expertise of the ISAM members through collaborative undertakings of programs and research that benefits the Filipino community. What can we contribute to the global community of addiction medicine societies? Well, we can share a relatively unique experience of optimizing addiction services, training, and research in a third world setting. We are, of course, in the quote, drug war, unquote, milieu, and continuing immigrant health issues with unabated Filipino diaspora, among others. That's all for me. Salamat
Thank
po.
you very much. And now we have Lambert Low.
Hi, good morning, afternoon, and evening to everyone here. My name is Lambert from the National Addictions Management Service of Singapore. It's indeed a pleasure to be here with other international delegates, and thank you to ISAM for organizing this. Next slide, please. So a little background about the National Addictions Management Service. We are an organization, a treatment institute in Singapore that helps to treat patients with addiction issues. It was first set up in 2008 with the support of the Ministry of Health, essentially provide treatment. And we treat all kinds of addictions, from drugs to alcohol to gambling and other behavioral addictions. And we are not just a team of doctors, we also have other allied health personnel such as counselors, social workers, psychologists. We have our operational and research staff as well. So we are fairly, I would say, a fairly young organization, and we come from a place where harm reduction is not really our modus operandi. Very often, if you talk about Singapore, you will hear about our zero tolerance approach towards drugs, and that is something that we need to have a continued conversation with our other international delegates on how your policies are working. So in terms of our current priorities, challenges, needs, and services, we hope to develop more and more about addictions treatment, in particular tertiary addictions treatment for persons with difficult to treat addictions in Singapore, as well as to provide research and training on addictions. And we do provide such training to various professionals, including counselors, general practitioners, and even medical students. So we do all kinds of trainings on the ground. Next slide, please. What do we expect ISAM to provide? We hope to network with all the experts here, all the professionals working in addictions. We also hope that we may have some opportunities to actually host regional and international conferences together with you guys, and possibly for other ISAM expert lecturers to speak to us on addictions related topics, in particular about policies, tobacco endgame, which is my area of interest as well. What can we hope to contribute to ISAM? We hope to participate in international surveys on addiction related topics, to host you guys in regional and as well as international conferences, and to perhaps collaborate on academic publications as well. Yeah, so that in a nutshell is a short summary from me. Thank you.
Thank you very much. Thank you very much. Now we have our next speaker from Indonesia.
Yes, thank you. Greeting from Indonesia. It's great pleasure to join this event today. At this moment, I am Eva, representing Dr. Danardi Sosrosumihardjo from Indonesia to share our organization profile. Next slide, please. Yeah, our psychiatric organization has an addiction psychiatric section consisting of 125 committed psychiatrists in addiction field. They provided services across the center and eventually came with some consensus about the priorities at the national level. We argue that the importance of the healthcare provider awareness and skill. So we suggest and that well-built education system are needed. Research also need to be put in the line to support education and evidence-based services. Next slide, please. However, we identified several notable challenges, from human resources to standardized services. Limited resources stand as our problems. Besides, the national guideline to address addiction issue is still young. Improvement are still needed, especially in the face of the emerging new drugs problems. Moreover, the pandemic also served as an essential contributor for increasing the case addiction. And in this event, we try to share our concern. Next slide, please. In this event, we try to share our concern and hope we could gain any assistance to resolve our challenges. We hope the assistance could provide better competence, more collaborative international research, and more updated information about addiction. On the other hand, we will try to provide as much as we can to providing training, research venue, and contributing in the paper to spread the knowledge about addiction. Thank you so much.